everyone, and welcome back to another episode of Balm Health Plus. Today, we are diving deep into the topic that many women are navigating: PCOS, or polycystic ovarian syndrome. But we are not just talking about the typical treatment plans. Oh no. Today, we are exploring how Ayurveda, the ancient science of healing, and how it can help to balance your body, your mind when dealing with PCOS. I am Dr. Miteshri Prajapati, and I'm going to be your host today. We have a very special guest today, Dr. Vishnupriya. She is an Ayurvedic physician, currently working as the senior health advisor at Vieroots Wellness Solutions. She also specializes in mental health, yoga, and oversees various health reversal programs, which includes PCOS reversal and diabetes reversal. Is there anything else that you cannot do? Dr. Vishnupriya, so excited.
Something really interesting for me to come and talk about PCOS reversal as well. So thank you for that lovely introduction, Dr. Miteshri.
Now,
Sure.
Ayurveda, as we know and we have heard about it, it's all about balance. So,
Yeah.
before we dive into PCOS and its remedies and treatments, let's talk about Prakriti. We hear this term like a lot in Ayurveda, but what does it really mean and how does it tie into managing something like PCOS?
So every time when somebody is talking about Ayurveda, there comes the first thing as Prakriti. So that is something because everybody is aware about the Prakriti analysis when they are going to an Ayurvedic physician. So they will be so excited. Some places we can actually see boards where they
Right.
are saying that Prakriti analysis will be done here. So Prakriti analysis is something very important. At the same time, which should be done with utmost care because this is something prakriti is something which is the inherent nature of an individual because this is not which is coming after you born, like it is there before you born, it is
Oh,
there from inside the womb, it's there. So basically when we talk about ayurveda, so there is always the talk about vada pitta and kapha. So
right.
these are the three doshas, so this is how it is. So vata means, so people think that these are three humors or three doshas there, but these three is having that kind of energy in it which balances our body. Because vata, when we are talking about vata, it's all about that neurological functions which is happening in our body. It's all about like if I have to move my hand, then there should be a particular vata involved. Now I'm talking to you, so my talk itself is controlled by a vata. And
Interesting.
like we said, because if we having people are having issues with pcos, when they're having issues with pcos also, there is a particular vata is involved, which is called apana vata. So this is there. And then when we talk about pitta, it's all about that our hunger, because we always have like hunger for everything. So this is not limited to physical things, it's also controlling the emotional things as well, the spiritual things as well. So pitta is always having control over our, like I said, our digestive power, then the hormonal imbalances which is happening in our body, even the menstrual blood which is connected, which is one of the upadatus of pitta. Okay, so this is how it is working. Then kapha, when you talk about kapha, it's all about the binding. Because kapha is something which is helping for our joints. Because we know that because there is cartilages there, we are having joints. Because there is always that fluid over our joints. So these are all balanced by kapha. So what I'm trying to say is these are few examples. We cannot actually come and correlate it with the modern thing. It's always the explanations, or it's always the correlations which we can find in Ayurveda, and which can also be related when we are in this modern world. So we have to connect it with the modern science as well. So
Right.
we can explain it like this. So when
Absolutely.
talking about Prakriti, yes, Prakriti analysis is very important when somebody is coming to me into my OPD. So I have to assess their Prakriti because I just wanted to know that because they may be expressing some symptoms. So we can let's take it as PCOS itself. So We always think, yes, when a patient who's obese and she's complaining about her weight, and she's
Mm-hmm.
complaining about her menstrual issues, and she's complaining about the mood swings, she's coming to an OPD. So I'm going to think that, okay, she's having a PCOS. She's having all the symptoms, it's just PCOS. Then the very next patient who is coming is very lean. She may be having like regular cycles. It just she is having some follicles or maybe some cyst in her ovaries.
Mm-hmm.
So how can I identify? Because if everything is the same, then the symptoms will be also the same, right?
Right,
So
right.
this is how it is different, because vata and kapha are the two things, and or I can say it like these are the two things which is causing as a causative factor for PCOS when we
Right.
talk about doshas. So it's because of the imbalance happening there. If it is a balanced one, it will never cause you any problem.
Sure.
So, because it's imbalanced, it is causing problems. So, Vata is having issues. That's why the menstrual blood is not coming, or it's because of they're having irregular oligomenorrhea. If I say like
Mm-hmm.
irregular menstruations is happening, it's because of this.
Understood.
And
So,
yes,
yeah.
so this is how I can say, like in a way, because it's very difficult to understand it in an Ayurvedic point of view, because we all know about how it is happening, because in allopathic medication or in modern science it's like it's a idiopathic kind of cause. There is no specific cause,
Mm-hmm.
but there are some causes also as well. So that some genetic factors are there, some idiopathic factors are there, or I can say that some lifestyle issues are there, so you can
Sure.
connect it with epigenetics as well.
Very interesting. So
Yeah.
basically, if you understand your Prakriti, you can actually like affect how we approach treating PCOS, which is so
Yes, yes,
fascinating. So,
absolutely.
yeah,
Yes.
so speaking of PCOS, when does it typically like develop within women, and how does Ayurveda view its symptoms?
So we can say that, because women is having like 28 days of cycle if it's a
Right.
normal one. Is this 28 days of cycle, is the 28 days are same?
Of course not.
Mm,
And in fact,
yeah.
like I have a 32 or 35-day cycle, which I don't know it's normal, but I hope it is.
So up to a 35, and it's absolutely normal, so it's not a big deal. But what I'm trying to say is women are going through luteal phase, ovulation phase, menstrual phase. So these phases are happening in her body. So
Right.
one, if you are talking to her on the Jan 1st, you're talking to her, she will be in a different way, like the things, the dealings are in a different way. But when we are talking to her on the 5th of the Jan, there may be some chances that her mood will be like involved in it.
Mm-hmm.
So
Mm-hmm.
what I'm trying to say is, it's always that women need to understand their body. So even like you can find some books like Woman's Body Bible, so where they're discussing about all these menstrual things, even they're discussing about how you should consider buying your bra, which is
Interesting.
also important, because if somebody asks you, you really know what is the actual size of your bra? No. If it consider like the size of the bra and the cup size, everything is there. So to understand female body, for females itself, there is something called a female body Bible book.
Very interesting. I haven't
So
heard about that before.
yeah, I'll definitely give the link about that book.
I will.
So so this is how it is happening. So what I'm saying is, like in Ayurveda, when you consider like in the childhood, I'm talking
Hmm.
about the childhood, and in the middle age and in the older age, three doshas are there itself.
Right.
In the age of childhood, the kids will be having kapha predominant in them.
Interesting.
Then when it comes to the young people, like from the teenage to the young, almost like that reproductive age of them, they will be having pitta predominance over there. And
Hmm.
when it comes to their old age, vada predominance is there. Every time what is happening is the transition is there. I'm actually connecting it with an Ayurvedic way, because we cannot actually find any such correlations with PCOS, because PCOS is a very new thing.
Right.
Right. Because what we can see is, we can consider taking few of the examples of few of the symptoms which mentioned in Ayurvedic text, and we can correlate with that. So what I'm trying to say is, every individual who's transferring from an age, like from childhood they're transferring to their uh, adolescent age. At that time, the kapha have to change to pitta. So
Right.
this you can correlate with how people are acting when they're attaining their puberty. So you can consider your puberty period, I can consider my puberty period.
For
So
sure.
this was really tough. This was really tough. We don't know if you are a child now, you don't know if you are an adult now, you
Right.
are in the middle of somewhere, you don't know what you are.
It's rightly called the period of storm and stress.
What happening is, these adolescent people, they don't know if they should talk to the kids, they can play with the kids, or they should go to the aunts or moms and all, so they can chit chat, they can gossip a bit. They don't know what they should do.
They're
it,
right
it's,
in
it's a
between.
very
Right.
imbalance. So
Right.
yes, so we can consider, because their body is changing at the time as well. There,
Absolutely.
the what is happening there is that hormonal changes that are
Mm-hmm.
attaining their puberty. So from the kapha they are changing into pitta.
Right. Which
So
marks the start of their
yes,
menarche. Right.
yes, menarche, and they're getting menarche. They are developing all the secondary sexual organs and all, and they started like, of course, the first period. I still remember my first menstruation. That was like terrible. I mean, maybe I can say that I was crying all day. Like, what just
Yes.
happened? Am I gonna die now?
Oh, that dread is so real. I remember it so well. Like, I
Yeah,
think most of the women will clearly remember the first time they
remember.
got their periods. Horrifying.
And the most funniest part is when we see the clouds, because we have never seen clouds in our entire life till that period. When we see the first cloud, we gonna think like, this is the end of the life.
Yeah. Right. Am I dying now? Is this
Am I
it?
dying now? Like, when it gonna stop? Like, it's so irritating. So
Right.
these things are there. So this period is also very important, because these period are also important because we have to change that child's habits and everything to something which is can be favorable for pitta.
Right.
Yes. So if this is not going favorable for pitta, it gonna develop more issues on their menstruation.
Understood. Right.
Because I have seen cases where they get the first periods, like they get the menarche. Okay, everybody is happy in majorly in India. Some parts of India are still celebrating that they got the menarche, like they are in their reproductive stage. It's
For
a big
sure.
thing. Not on the urban places, we can actually find it in all the rural places. Like, people celebrate it. So what is happening is they're actually transferring into something new, but at the same time they have to adapt few lifestyle modifications over there.
Sure.
What is happening is, if they're getting the menarche, and then the consecutive months they may not be getting it,
Hmm.
but the child is happy because, okay, now I'm not bleeding and all. But many people are not noticing why she is not getting that regular menstruation.
Right. Why is it
This
not
is
coming?
very important. Yes, you have to get your regular menstruation, which is important, because some people think that, okay, it's a burden that I don't have, means it's not bleeding, so it's a good thing.
Mm-hmm. Mm-hmm.
But they have to understand it from the age itself, that it's very important to understand that you need to get your regular menstruations. If it
Right.
is not happening, then you should get it checked what is happening.
Mm-hmm.
So
Mm-hmm.
this is also, so what I'm trying to say is, majority of the teenage people are having PCOS,
Right.
and we can see all this obese 60 percentage of all the cases which is coming to the OPD is having obesity. All the teenage people are having obesity. This is like very shocking for us, because they must be in her very active period. If somebody is asking me, I can say that, okay, I am just bit lazy today, like I don't want to go for a workout, I can even say that. But in child, means in their teenage, they should be motivated more to do exercises, to do
Absolutely.
all kind of activities.
Yeah.
So this is what I believe, because the from the menarche itself, they always have to, they consider it as a life changing moment. Actually, your life is changing from then. It's not
Right.
just revolving around your because some people used to say that my mood is all revolving around my menstruation. No,
Oh,
your
yes.
yes, your mood is not revolving around menstruation. Your world is like wide. You can explore a lot of things, but you can see that some women like they go for pills. What I'm
Hmm.
talking about is the hormone pills they're taking.
Right.
Yes, this is also an important cause because I have seen a lady who came, actually, she came for an interview with me and she was having severe pimples on her face.
Mm-hmm.
I just asked her because I was not able to concentrate on what she's saying. So
Sure.
my focus was completely on her pimples, and I just asked her what is happening. I'm trying to conceive once again, like she was having say some secondary infertility kind of thing. So she want to conceive once again. She's on pills, and
Oh.
now as a side effect, she got all her acne. Like because she was on hormone pills, she was getting this acne.
So you're talking about the birth control pills that most of the ladies.
Yes, most of the people take birth control pills because it's very common. And
Right.
sometimes, if they want to conceive, also they have to go for like certain hormone therapies as well.
Right.
At the
Right.
time, also they are getting these kind of issues, these kind of menstrual issues, and along with that, many other issues like their metabolism is getting affected.
Hmm.
Like I said, so it is also very important, like because they go for hormone therapies and maybe ending up in PCOS.
Very interesting. So
Yes,
basically, like what you're trying to say is in PCOS, there is a signal that the body's flow has been disturbed, and
yes,
that's how you know that this is the beginning of the symptoms for PCOS. Is that
yes.
right? Got
Yes,
it.
because
Okay. So
every time it's important to understand your body because it's really communicating to you.
absolutely. No, I second
Yes.
that. And so just wanting to know from you that how is PCOS diagnosed from an Ayurvedic perspective? Like, is it different from the modern medicine or the conventional methods that we have always been hearing about? What's your take on that?
So I would say it's very important that the modern diagnoses are really good. I would say that because I'm running this PCOS reversal programs, so we actually put all these blood tests as an important thing to assess if they are
Right.
doing well because how their results are coming. But along with that, like there may be some uh, experts who can talk about this on your podcast itself. So what I'm trying to say is, in Ayurvedic point of view, I actually always take it in a way like we go for all the blood tests, but along with that I go for the Prakriti analysis, but in a
Right.
different way,
Mm-hmm.
because Prakriti analysis is there. So Prakriti analysis is for the healthy people, so that you had to understand what the kind of Prakriti they are with.
Right.
Then you have to go for some Vikriti analysis. Vikriti means it's not like the naughty kid or anything. So it actually means that our body through doshas, like I said, Vata, Pitta and Kapha, is getting bit naughty there
Hmm.
because they're having some issues, they're causing
Some
issues,
imbalance.
some
Right.
imbalances are there. So this is the actually all these words are quoted by the acharyas in Ayurveda, so they know that they actually know that like the naughty things are happening, so they are causing you diseases. So this is how
Interesting.
they are mentioning. So in that we have to go for few examinations, like you have to go for nadi pariksha. So
Not
from Nadi Pariksha, it's like the pulse examination. It's not just the pulse examination that we got, okay, this is your heart rate. No, it's not just that. This is a bit different because once you ever been to any Ayurvedic physicians, you will get to know because they can assess it with your pulse that what kind of prakriti is there or
sure.
what kind of issues that are happening there, what kind of vikriti is happening there. Then the
Okay.
next one is you can go for like observing them. Like if they
Hmm.
say like darshana sparshana prashnehi, because you have to see the person first. Then you have to see it. So if I can see that when I'm seeing a PCOS person, I can see a lot of things, right? I can observe them, how they are walking, how they are coming to an OPD. Like is that person is lean, is the person is obese? We'll get to know that. And we can see that if they're climbing stairs, they'll be very tired because insulin resistance is an important thing happening there. So
Absolutely.
yes, so these kind of things are there. Then we start asking them questions.
Hmm.
So when we start asking about questions, though, every time it's very difficult because majorly the doctors what they do is they're having thousands of patients in an OPD every day. So they will be asking you, okay, what happened? Okay, when was your LMP, last menstrual date? Which was that? Okay, you didn't go. Okay, go for this test. That's it. Okay, done.
It's
And
like a
that
template that they
it's
are
like a
following.
template, because we can see that this is there in the software, because they
Yes.
have to fill this software. Because if the doctor is asking you questions, there was a period doctors used to write, but now
Right.
they're all feeding
It's
it in
all
the
in the
system itself.
system.
Yeah,
Yes.
it's in the software. We have to, means it's the case sheet is there. So you have to fill all these criteria.
Mm-hmm.
But it's very important to understand a fact, like what kind of a lifestyle they are living with.
Yeah. Yeah. Very
It is
important.
very, yes. If somebody is coming to me, and I really take around like 40 or 45 minutes for a patient, because
Wow.
I just wanted to know that what is there happening with them.
Very
Because
personalized. I love
yeah, it's
that.
very personalized, because it's very important in the sense, then only they open up. Women have an issue, because every woman, I'm not talking about a particular woman, but every woman, they, when they want to treat a PCOS, they consider it as it's just PCOS. No, it's not just PCOS. You have to consider it as something very important, and you have to make sure that you want to heal that. So for that process, we have to ask them few questions, because stress level is also very important.
You brought a very good like point in
Yes,
this stress management, which we are
yes,
definitely going to talk about in
yes,
further questions. But
yes,
so what I'm hearing is, Ayurveda views the whole person. You
yes,
consider the whole picture. So it's just not do this test or do the blood parameters, but it's also about the nadi, like you said. You'll check the nadi, there's the prakriti, there's the vikriti, and then with all of these tests. So I think like you are viewing the health very holistically. It's a very holistic lens.
absolutely. You just said that word. That is
Right,
the word,
right,
holistically. Yes,
right. Very nice. So that brings me to my next question, which is like, how let's talk like about alternative therapies. So PCOS often like leads women down the path of exploring so many like alternative therapies or natural therapies, more plant-based therapies. So
yes.
what Ayurvedic remedies do you find are most effective for managing PCOS?
Okay, so this is a big question, I would say, because it takes a lot to understand the person. So, if I cannot actually say that this particular medicine act for this particular disease, no,
Okay.
because why I'm saying this is once the Ayurvedic gynec, means, uh, because it's a company, they approached me and said like, okay doctor, we can work with you, but the thing is you have to write all the medicines that which we are having.
So promoting their
Yes,
medicines.
promoting their products. So I understand, okay, you should actually need business, you should promote business, so it's there. But what I understood is she was so strict that I'm not supposed to write any other medications, which
Ah,
should be only from them.
oh,
And what I felt is this is more than a business, because what I'm doing is I wanted to heal someone. So for that, I need to, means, if some medicines are not there in your list, am I not supposed to give that to my patient? I have to give her, because this is something gonna heal her. I really
it
have to
comes
give her
down to
that
ethics,
medicine.
I guess,
It's
right?
it,
We're talking about
it,
ethics
yes,
over here that, hey,
yes.
like, I'm happy to promote your product, but if there are better products out there, I am going to advise them to take that.
Yes, it's not the product itself, it's about the classic medications.
Hmm.
Because she said that you name it, we have it. I said like, no, you will not be having that.
That is very
So
insightful because these kind of things, I think normal people who are not from, like pharmacy or medicine background, we don't understand, like what happens, like how is that business running? So it's very insightful that you mentioned that, there are some companies that want you to only promote their products or their medicine.
because why I'm saying that, like you said, it's a holistic approach. It's a holistic approach. Now, also, if you're asking me which are the good medicines for PCOS, I will never say a single medicine's name because
Sure.
it's not just that medicine gonna cure them. I cannot actually say that, okay, you take this particular decoction, you just take this particular pill, you're gonna get healed. No,
Mhm.
I actually wanted to know that what kind of a digestive power you are having,
Right.
what kind of
And
a digestion
accordingly
she is
suggest.
having. Yes, I just wanted to know that what kind of a life she is living. What
Right.
if like she is having, so I'm talking about an Indian point of view because I'm in India. So what if she is an Indian and she is working for a US company? She must be working at the midnight.
Yes, absolutely. That you
Yes,
bring up a very good point. Like
yes,
there are PCO, women with PCOS living globally. They have erratic
yes,
schedules. So many like different
yes,
lifestyle factors that are playing in, and
yes.
it cannot be like one pill solution for everyone. It has to be tailored and customized for their body's needs, right?
I always tell them because you have to understand that you have this particular condition. So, what you have to understand is you need to heal it in a complete way. It's not just thinking that, okay, I just take this pill, I am done with that. No, it's the whole lifestyle. So,
Working on the root cause,
yeah, on
basically.
the root cause basically. So every time we need to get to know the root cause, then only if I should understand like what her vata is affected, what her pitta is affected, or kapha is
Absolutely.
affected, then I have to treat on that. So
Absolutely.
this is
Very
yeah, this is what I'm trying to say is it's very difficult to give a, I cannot actually give that, okay, this is the particular medicine or this is the particular yoga you should do. No, this is all personalized. So, what is my humble request to those who are watching this is always go for a personalized medication or personalized lifestyle modifications.
Absolutely.
Not every size fits everyone.
Yeah, yeah.
Like it's like not the single size fits everyone. So every
Absolutely.
time you have to find out what is important for you. So now look at Miteshri and look at me. We both are having different prakritis. You can
Right.
actually buy visible, like I said, Prakriti. When you analyze Prakriti, there is like different questions. Look at your eyes, my eyes. Look at your hair, my hair. Look at
Mhm.
your skin, my skin. Everything is different.
I love
Yes,
that. So the
yes.
idea, that addressing individual needs at the root cause rather than just masking or taking care of the symptoms. I love that.
Because people are so busy because now you know the undertone, now you know the cool tone, every tone, when which dress
Oh,
you have to
yes.
wear. Everybody knows that. So you should understand not every pill is gonna give you, not every anti-diabetic medicine is gonna give you like solution. Not every single medicine is not gonna give you solutions. No,
I
it's
think
personalized, it's
I
different.
think the irony about today's times is that people know their foundation shade better than they know their body. I can really
Yeah,
say that.
that's what I was saying, that people should really read the book, that Woman's Body Bible, because it's very
I love that.
important.
Yeah.
Because it's not just I am promoting this, because this is what I feel, because I actually keep that in my OPD. When means I know like majorly movements are coming in my OPD, so
Oh,
this book
yeah.
is there.
I
So
love that.
they just come and they have a look because it's a very attractive book, and they just come and they just have a look at, is there anything like this? And then somebody actually said to me like, okay, I will read the real Bible. So I said, okay.
Very nice. It's one way to like get people to
Yes.
read that book and know their own body. So I think you're doing a fantastic job educating them, raising awareness, and motivating them to really listen to their body and be in tune.
Yes.
I love your approach, Dr. Vishnupriya. You're doing
Thank you
a
so much.
fantastic job. So just speaking about balance and hormonal imbalance, and you mentioned insulin resistance in between.
Yes.
So how does Ayurveda specifically help with these?
Okay. So, like I said, I will be mentioning about the Ayurvedic part only because I know there is a lot of experts who can talk about the insulin resistance, their medications, and all.
Right.
So, once if, I will give it as an example, like if somebody is coming to my OPD, because I always check that are you means, and like I said, I go through their lifestyles. I go through lifestyles because I have a dietitian. So the few of the questions will be means answered in my OPD, and I have a very intelligent dietitian with me.
Very
And
nice.
what she do is she do a dietary recall, like it's a
Ooh,
recalling.
yes. So asking them what they have eaten.
Yes, what she is doing is because I love her approach, and we've been working together for past 3 to 4 years.
Wow.
So she have that approach of asking them, you just recollect what of things you eat every day. So
Yeah.
they will be like, okay, they actually say everything to her.
Okay.
Everything to her, because that's a huge saver for me, because I'll get to know everything about this particular person's habit.
I love that collaboration and working
Yes,
as a team to see that.
yes, I have this approach with my dietitian, and I have
Love it.
yes, a health coach as well. So my
Ooh.
health coach is also there. So when we start with our, like I said, I do this PCOS reversal programs. It's a collective approach, like I said. So we always go for the dietitian is there, the health coach is there. So we three sit with the patient, and there will be a family member from the patient's family. It's just to observe that if the person is doing well, if the person is actually following it up. This is
Very
important, because in the very beginning stage we will be actually giving them like a shodhana. We say shodhana, it's a cleansing therapy.
okay.
It's very like I said, kapha is involved so much in PCOS. So kapha and pitta is involved, that's why you're having hormonal issues. Kapha is involved because you're having metabolism issues are there. So first of all we have to do is we have to make sure that they undergo a detox
Cleanse.
therapy.
Mm-hmm.
Yes, means cleansing is important.
Yes.
When you talk to any Ayurvedic doctor, they will say that okay, then your stomach should be cleansed first. So it's like your gut is the main thing. You like because the serotonin, which is actually producing in the gut.
In the
So which
gut,
is
yes.
yes. So gut is we cannot actually leave gut for anything. It's that gut brain axis which is very important.
I was about to say that gut is referred to as the second brain in a
Second
person.
brain, yes,
Yeah,
exactly.
love it.
You said the point. So that is there. So I would say they have to cleanse or they have to clean their gut. So it's not like I'm giving her a medicine and
Mm.
asking her, okay, go to toilet like 5 to 6 times, your stomach is cleansed. I cannot give that. I
Yeah.
cannot just tell her, okay, do this. No. What we do is I'll be giving her medications,
Mm.
and my brilliant dietitian will be giving her a detox diet as well.
Love it.
Yes. So after that, they started feeling the body is very light.
Hmm.
So what I'm explaining now is a very basic thing. It's not a personalized thing, but it's how the basic things are working. Then we will ask them to go for a metabolic enhancement. So the next step is a metabolic enhancement. Here I will be taking care of their insulin resistance. Their diabetes. Some people who's coming to the OPD must be pre-diabetic, some must be diabetic as well. You
Right.
understand, right?
Different stages, right?
It's not gonna take like last week I was part of a retreat program, and the patient who was in the OPD said that before the blood test he said that okay doctor, I'm just pre-diabetic, okay. And that very the same day I got his blood reports and he's diabetic,
Full blown diabetes. So
full
I
blood
know.
diabetic.
Yeah, yeah, yeah.
So
I
this is
understand.
not going to take much time. So what trying to say is, first of all, they have to go for this detox. Then they have to focus on their metabolic enhancement. So I'll be giving medications which is important for them to reduce or have to adjust with their kapha and
Hmm.
some of the other factors which is involved. So I have to take care of that. Then
Right.
along with that I have to increase, so now I actually detox them, so now I have to increase their digestion as well. So I'll be giving some medications for enhancing their digestion and metabolism.
Right.
So then the next thing is coming, the third one is coming, is the channel cleansing. So Ayurveda believe that there is a lot of channels in the body. So
Okay.
when I'm saying this, people will be thinking that what this doctor is talking about. So everybody knows that there are glands,
Absolutely.
pituitary glands are there. So HPO is very important in when you're talking about a female reproductive system. HPO axis is very important. So what I'm trying to say is it's very important to cleanse the channel as well. So
Mm-hmm.
I'm trying to say that the HPA axis must be cleansed. It should be under the observation that it should work like this, because we have to give those medications which can induce the flow of the hormones and which can result the menstruation, because they are
Right.
going through irregular menstruation. So I have to focus on that. It's not like the very first day I'll be giving them medicine, okay, you just take this medicine, you will get your menstruation. No,
There
have to
has
go
to
step
be
by
step
by.
by step, yes. So
Then,
cleanse,
yes,
let
then I'll be
flow.
going for, yeah, sorry. Then I'll be going for Dhatu Poshna. We said like tissue nourishment. So I actually made them work this much. So now I have to give them some nourishment, right? So I'll be going for nourishing this because the Vata is involved. When Vata is affected, I have to treat it by some nourishments. So I'll be providing some nourishing, like which is nourishing the tissues, because these people, those who are coming to this with PCOS, always they are really obese, maybe overweight, maybe lean. What is
Hmm.
happening is they are having that tissue loss there. They are having the tissue loss, they are having muscle loss. Some people are having muscle loss. Some people will be suffering from different kind of, like maybe their blood means values are less, the HB levels are low. So I have to maintain all those, I have to nourish all these things. So this
Right.
is what I do. And the final state, I'll be only focusing on the reproductive organ. So I have
Hmm.
to nourish the reproductive organ, and that's the 5 stage I work generally. But it changes. It changes. Like I said, it is personalized.
Right, right. I love this. I am loving to hear this perspective, this step by step approach, which is not like, here, take this magic pill and whoop, it's gone, you know?
There
So,
is no magic pill,
yeah,
unfortunately.
exactly. And I think it's very important for the listeners to understand that when it comes to managing and really targeting the root cause, it's not like one pill and poof, it's gone. It has to be the step by detoxing, cleansing, then re-nourishing and things like that. And I am so grateful for you to like explain this to us, because I don't think a lot of our listeners know about this. Even I didn't know about this. So this is really interesting.
Because as a part of coming to this program, I was just asking my team to help me, like, okay, how this is actually generally going, because I
Yeah.
have given this interviews and all, but never been a part of a podcast where I should discuss this. So they said like, okay, doctor, you just have to explain about this things, okay, because people are talking about ashwagandha, people are just talking about kurkumin, you just talk about it.
Yes, I was about to ask like, what about Shatavari? What about ashwagandha? What about turmeric? Like, tell us more, doctor. Because
Oh
there
my
are
god.
so many like viral reels and like videos circulating on social media, and every other person is talking about ashwagandha. Every other person is talking about turmeric and its benefits and amla and some or the other things related to Ayurveda. So I'm like,
Yes.
how much is it real? What is the truth behind all of these videos?
Uh, I'm glad that we are having a very digitally awakened kind of society now.
Yeah.
But the problem is everybody is an influencer. Everybody is an influencer. So people are now confused.
Oh,
Means,
yes. So
yes.
many sources of
Yes,
information.
so many confusions are happening. They just don't know to whom to believe with.
I agree. I
Yes,
agree.
because when I was like my team said, because doctor, many people are talking about PCOS. Okay, yeah, means whom with whom you want to listen? I said like I don't want to listen to any influencers, because see, for that this is not a single drug, because I happened to see that a particular lady was giving her recipes of how she lost weight when she was on PCOS.
Hmm. We
Okay, if
have
she,
so many of those videos, and they always have like million views and stuff, like that.
because now they can bot the, because all these likes and all they can bot. But what I'm trying to say is they have to understand the qualification, maybe like a basic qualification of what this particular person is. because anyone
Right.
can talk anything. So now it's an easy thing. If you have a good phone, if you have a good internet connection, you can just make a video and you can just spread it on your account and it will be like going viral.
Influencer.
Influencer tag, but I'm not being that Kareena Kapoor influencer thing here. But I'm just sad that sometimes people are not getting the real information about the things because of this particular habits, because they're following they're following somebody who's having a lot of followers.
Yes. Oh
but
my God. Thank you for pointing that out. Yes.
but
Like,
yeah.
seriously, like people who are qualified, who have degrees, who have been treating patients, they may not have followers, so people are not ready to listen to them. But just because an XYZ influencer has like 1 million followers, oh, of course,
Oh
like,
yes, of course.
yes,
I think
that is the
this,
expert. That is the one I should be listening to.
this reminds me of something funny happened. Okay, like it's just one girl, one very pretty girl who was working with us long ago. So she said like she don't eat anything healthy. She's just using products over her face, and she's having a very clear and good face. Like its skin is really nice. We are
Okay.
so happy that okay, you are having a good skin. We're like okay, good. And she, whenever we say like okay, you're eating a lot of oily foods, she's like oh no, I will never get pimples. So this
Okay.
is there. Once she shifted to a European country, and she just tried a Korean product. So they said like some Korean product, some influencers were promoting it.
Yeah.
I felt so bad for her because she started developing a lot of skin allergies, so many
Oh,
pimples over her face. This happened to her. So that was so painful to watch that kid suffering from this only because the influencers did this.
yeah. Yeah. No, you're right.
So yes, so this is like because people are so obsessed with the skin tone because they just need, it's more than the clear skin, they need a fair skin tone.
Fair skin, glassy skin, shiny
Yeah,
skin.
now they have some glassy skin
I have
thing.
lost count. I am so like done with it. 12 step, skincare, 13 step. No, I'm sorry. Like I cannot do any of that. But just talking about, like Ayurveda in general, are there any herbs or, like specifically which can be beneficial if women with PCOS were to like consume or take those herbs or plant-based foods in certain, like just want to know like if there are certain herbs out there that can actually help women with PCOS.
Yes, like I said, because there is Triphala, which can help them as well. But you should understand after a particular time, you really have to stop that.
Hmm.
Because what is happening when, because when people are taking Triphala daily, and
Ah,
sometimes they end up in having constipation, severe constipation, because they're
right.
taking a powder form. So which is very important. So I will say that there are few herbs, like you said shatavari is there, shatavari is very important, but I will never say that just to go only for shatavari. So because the all the products, all the names that you mentioned, it's,
Hmm.
they are herbs, I know they are herbs, but they are famous because they are getting it as supplements.
Right.
Okay, so there is a lot of single drug therapies that you can see because some particular herbs are there. Like if I say that we are having some ashoka lista, so which is having like ashoka is the main ingredient of that, which is helpful for all the menstrual issues. So it
Hmm.
depends on what kind of issues you are having. So which
Right.
is not just with the ashoka plant, because which is having a collective number of plants, herbs are involved in it. So it's very difficult to say about just one particular drug, two particular drug. No. So I will say that the medicines act in a conjoined way.
Right. It cannot be like isolated, like this ingredient or
When
that
it is
ingredient.
isolated, it is supplements. When
Mm-hmm.
it is combined, it is having active constituents are there. So which is
Right.
having different mechanisms in like different parts are having different mechanism.
Right.
So it is different.
Hmm.
Yeah.
That's really like very interesting to know. I mean, all of these
Yes.
things are available in the nature, and I'm so glad like there are things out there that can be used in some form, maybe in
Yes.
a supplement or in medicine, how you said. But of course, it should come from a qualified person and not an influencer on social
Yes,
media.
because we should definitely get to know about the dosage every time.
Absolutely, absolutely. Yeah, thank you very much for that information. So, you mentioned about stress being a huge trigger at one point. So, how do body and mind practices like meditation or yoga help women with PCOS, especially like when it comes to stress managing in women with PCOS?
Like I said, stress is a very important thing because it's not just about PCOS I'm talking about. When it comes to when I do PCOS reversal along with diabetes reversal as well.
Mm,
Because when I see people with diabetes, they're not, because we monitor their blood values every month. Like, so if it is not reducing, sometimes we do it weekly basis. If it is not reducing, we just ask them what is happening,
right.
because it's very important. Because what is happening means when a doctor or there comes the importance of that health coach, because she is talking to the particular patient every day. In my PCOS reversal or diabetes reversal cases, my health coach will be talking to the patient every day. So they will be small changes in their mood is noticed. It
Mm-hmm.
causes elevated levels of cortisol, like cortisol is the stress
Stress
hormones.
hormone,
Yes,
yes.
and which affects the whole metabolism, which affect the whole metabolism, because your sleep also get involved in that. If your sleep is bad, the cortisol is high. Okay, definitely, like it's a bad sign.
Of course, it affects the insulin, it affects the
Yes,
other, like hormones in the
yes,
body, and it might worsen the PCOS symptoms. Am I right?
yes. So what I'm trying to say is, because these are all very much connected, because
Mm-hmm.
PCOS is also similar to diabetes reversal, I would say, because this insulin resistance is there in both cases. So in that cases, whenever I actually ask them, because before we starting our reversal programs, etc., we actually give them a stress questionnaire.
I love that because I don't think a lot of people do that because it's important how that patient, that person is managing stress on a daily
Yes.
basis.
Why I said that is because stress is very important to discuss about, because I was doing my post graduation diploma in mental health, and
Hmm.
what I understood from that is all this reversal program is working on a cognitive behavioral therapy.
I'm so glad
Because
that you mentioned that. I love it.
yes, because
CBT,
it
yes.
works like that. Because why this reversal programs is means there is a health coaches, because the person is under a surveillance. They are actually we are observing them. I'm
Mm-hmm.
not just giving them medications and then just not just asking them to okay go. They come back after 14 days. That's it. No,
Yeah.
because I'm actually giving them a health coach, so she will be observing for me every day.
Yeah.
Yes, she
Shout
will
out to
be.
like all the qualified health
Yes,
coaches who are putting in so much work every day.
yes, because they are like amazing gems, I would say. And my
Oh,
health coach is like, if she is on leave, also she'll be updating them in the WhatsApp group. I can see that. So sometimes I think, okay, thank God she's not my health coach. Like my life will be like very terrible if it does. But
no,
it's
I
not
love
that. But once, if you're having a condition of PCOS or anything, you need a particular observation. So even your best friends can do that.
I love that. Yes,
Yes,
like having that
yes,
family support or social support in
it's very
managing your
important.
stress.
It's not like people think that okay, I have PCOS, I am putting on weight. Okay, that's the end of the life. No, you don't have to live with that. You can actually like defeat it. You can do that. So this is everybody have to understand the fact of like you can also defeat this particular condition and you can live your life like the way you want.
I
So
love
why
that.
I said about I just drift off from the topic. Sorry.
No problem. We
So,
were just talking about yoga and meditation.
yes,
So,
yes,
like,
yes, yes.
are
So
there any particular? Yeah, please go
yes.
ahead. Sorry.
Yes, I would say that because it's not just yoga, they have to go for like a regular aerobic sessions. Like you can go for an aerobic sessions in the beginning, like a moderate aerobic sessions, which improve the cardiometabolic health,
Right, right. So
which is
running,
very important.
jogging, swimming,
Yes.
cycling,
Swimming,
walking,
cycling,
anything.
everything they can do. Then I will say that they can go for yoga as well, because it's not just limited to yoga. I would say they have to go to gym. If they're okay with that, they have to go to gym. If you like to go for Zumba, go for Zumba. If you like to
Love
dance, go dance. But you should have a regular kind of activity in your life.
physical movement, any
Yes,
kind of
physical
physical
movement. Any kind of physical movement is very important, because this should be there. If you just want to go for a walk, just go for a walk.
love
This is
it.
important, because one of my patient, she said like, okay, doctor, my kid is having exams today, but what I did is I just walk around my house, like I was walking on the premises. This is a good sign that she is not giving up.
Yes, yes.
Yes, then I would say that, so I was collecting some studies, and I saw that there were like 3 month consecutive yoga practices were happening on the women who are having like showing the first symptoms of PCOS. So they just collected them, and they observed it with some few asanas like Bedhakonasana, Sarvangasana, and Bhujangasana, and along with Surya Namaskara, which is very
Right.
important. Yes, I will say that Surya Namaskar is having a separate fan base, if I would say, because Surya Namaskar is very common now, because everybody is doing that. Everybody likes to do that. But sometimes, like I said, it's very unfortunate to watch. Like one day I was on LinkedIn early morning. Okay, I was just traveling to my work. I saw that a particular lady was doing Surya Namaskar in a very tough and a difficult way.
Oh my God. That
I
can be
think
hurtful and
that
painful
that's
later on.
yes, because what I felt like, see, when I mention about doing yoga, okay, now if somebody is listening to the podcast, they go and watch yoga videos. If they are getting any videos like this, they will get demotivated.
Hmm. Thinking that, oh, I can't, my body is not flexible, or I can't do
Exactly.
what she is doing, right?
Exactly. So there comes the difference.
Right.
Because I don't think that all these influencers, so-called people, will be doing it for the purpose that the other person should follow. No, it's like only a yoga certified instructor. Those who ever trained anyone can only understand when to do this exercises, or how to do this exercise, how to do the
Yes.
yoga postures, where to hold your breath, or
Hmm.
where you have to be relaxed, what is the sukhasana, what is the final pose. Only a certified person can do that to you.
I love that point that you're bringing up. This is
Yes,
such an important reminder to not just like blindly start following a random yoga
yes,
session on
yes,
YouTube, but to follow
yes,
somebody who knows your body. Okay, this is the challenge that you're going to face. So, how much should you stress on your body? How much should you like let it go and keep it easy, Like these are such important reminders because yoga, if done right, has benefits, but if done
yes.
wrong, it can really
Has
harm
its
your
own
body.
issues. Yes, that's why they always say that it should be done under some surveillance. Someone should be watching you. Someone should be
Correct.
there to help you out. So
Absolutely.
always with this podcast, I just wanted to give an idea to everybody that you should always go for professionals. You should please try, like look at Miteshri, like she can help you out with all your diet doubts, because she is the epitome of that. So she is somebody who can do this. So people have to find out if the person is professional in this, if the person is
Correct.
specialized in this. This is very important, and certified in this. This is very important. So
Very.
yes, even now also I can say that, okay, I can tell you that, okay, just do sarvangasana, just do surya namaskara, and that's it. Some nadi shodhana pranayama, some kapalbhati. I can say that, and I can go. But what is happening is, after listening to this, they go and search anything from anywhere, and they will do it wrong. So
Yes.
just find a good master, yoga master for yourself, and start doing it.
I love
Because
that.
this is a very humble request to everybody who, if whoever is listening to this.
Yes. Love it. Thank you so much for mentioning that. Listeners, please only trust the professionals who are
Yes.
qualified, who are experts. Don't randomly start any YouTube video and following that. No, that's not how you do it.
Because the other Surya Namaskara saw that day, which actually watching that itself started hurting my back. So
Oh my God, I can imagine how wrong, the
how,
person.
yeah, she was actually jumping in that. So this is
Oh
not
my
how
God.
it should be
Yeah.
done.
Okay, no, thank you so much for mentioning that. So that brings me to the next question, which is like diet. Of course, like as a nutrition scientist, I know how important role a diet plays in reversing diseases, in managing the symptoms, and things like that. So, what are some like Ayurvedic dietary changes a women can make, which are, like, I'm not going to ask you for specific supplements because I don't want the listeners to blindly start taking them. But how can Ayurveda and, a diet which is based in Ayurveda help women with PCOS?
So it's a big question. It's a big question because diet is very vast, like
Right.
it's a vast subject. So what is happening every time is I have few very elder physicians, those who are like seniors to me, those who are like maybe like the very most senior doctors. So they, it's like when they were practicing, they never thought about okay change diet and all. They never mentioned anything about that. They said like okay give this medicine and it will be fine. But
Hmm.
after a period of time, these doctors started saying that okay you should avoid this kind of food and then you will be fine.
Right.
Yes. But what is happening is, yeah, keep on telling people like you should avoid junk, you should avoid maida, maybe you should avoid simple carbohydrate, like maybe oily foods, etc.
Refined foods.
You
Yes, ultra
refined foods,
processed.
like collectively like refined foods. But are you really getting an idea like they are telling you that you should eat this?
So they are mentioning and focusing of what not to do rather
Do.
than just informing, like, please include this or start doing this.
This is a similar psychology works with the kids. So you
Mm-hmm.
must be knowing that if we are telling the kids not to do this,
They will
they will go and do. So
they
we are
will
telling
cause
them not to eat junk foods, they will be like go and do that.
yeah,
So what we can tell them is eat this food. So that is actually getting into their mind. Eat this particular food. So they will be
focus
eating
on the
that.
do's, focus
Focus
on the
on the
do's and
yes.
not on the
No.
don'ts. Right. I love that approach. No, you are so right. Like emphasize on the do's. What is it that the person can do rather than asking them, don't do this, don't do that, don't eat this, because they are ultimately going to do that.
Yes.
I get your point.
Because this is very interesting that so I started telling them I will never say like our diet plan is very funny because what we do is we mention all the breakfast like we actually start with the food they can or the what they should drink in the early morning itself
Love that.
once they woke up. From that then their breakfast midday mid morning meal and their lunch their evening meal and then after the dinner and maybe something before their bedtime. So we'll be collectively saying all these things in that particular diet plan, and we mention in small letters in the like in the end of the diet plan what all things you should avoid.
I love that. So that the focus is only on the things that they should be doing, they should
Yes.
be eating, and not
Yes.
on the things that they are supposed to avoid. I love that approach. I hope that has been successful with your patients.
It's a psychology.
I love
Actually.
it. Yes, yes, yes. No,
So
I
we just focus every time on that. But if you say, like, I have seen people saying that it's low carb and you have to go for high fiber, high protein. So it's like low carb. You're just when saying the low carb, low carb. Sometimes people say to cut down the carb. These are the different things they're telling you. So I will say that Ayurveda mentioned about a lot of good protein, means high protein sources as well. So we said like Chimbi Dhanya Varga. So we said like that this is all the green grams, black grams, and all the gram kind of things are coming here. So this is actually a good high protein content, that means high protein kind of food itself,
Are you
right?
referring to the beans, the different kind of
Yes,
beans?
different kind of beans itself, so you can
Okay.
use that. So that is important because which improves the menstrual irregularities, which actually help them to make it regular, and
Hmm.
also for the better lipid profile. Like,
Okay.
the cholesterol levels are also high in those who are coming to the PCOS
Yes.
cases, yes.
Yes.
And they complain about the weight. So India, especially in Kerala, so I'm from Kerala, so what I say is, when somebody is putting on fat, we say that it's because of the cholesterol. So, I actually said it's because of the cholesterol. So it's not just that. So once you are consider taking something, if somebody is telling you you have cholesterol, they will be like, okay, I will not eat anything which is oily food, I will not take. But they say that I will not take, then they don't know what to take. I should not take this, but what should I take? This is important. There
Right.
comes the importance of the fiber or the protein. So these kind of things are coming over there. So
Right.
this is mentioned in Sushruta Samhita like long ago, like what all are the good foods that you, when you consider, like I said, the correlation says like that. Then there comes maybe like so shocking for many, because Sushruta in Ayurveda he mentioned about all the women with PCOS, or all the women who are having like Artava Granthi issues, they have to take Malsya, means it's they have to take fish.
Oh, that is so fascinating because I have heard so many Ayurvedic practitioners saying don't eat meat, or, don't include any animal sources in the diet. Like, you have to like switch to a plant based or a very sattvic diet to cure or reverse all of these things. So this is very interesting because this information is also like somewhat confusing but new to me. So can you like shed some light on this topic?
Sure thing, because last Easter, I think, on the Easter time, so like everybody else, I got one day off. So I was just going through the phone and I saw that there were so many emotional posts on Instagram
Okay.
saying that the animals sense that they are going to die. So these kind of emotional posts were there. So then I just want to know what is that. So then I end up seeing that they are promoting sattvic diet.
Right. Right.
And some people say that, okay, because people get confused, because many Ayurvedic doctors are also saying that not to eat meat, not to eat kind of chicken, not to eat
Yes.
mutton.
Yes.
Okay, these
I've
kind of
also heard
things.
that. I've read it. I have seen the reels promoting sattvic diet. So what do you feel?
Ayurvedic diet is different. Ayurvedic diet never says that you should never eat meat. No, they actually, there are a lot of acharyas who's promoting all the, they are mentioning about this fishes are living in this particular area, and these people should eat, those who are with kapha prakriti should not eat this particular fish, they can eat the other fish.
Interesting.
Because when the person is having aggravated vata, you should take this particular meat. This is important for you, this is there to balance your body, that they are
Wow.
mentioning about it already. They said about this already, then how can somebody, like, if the acharyas are saying about it, then we are just doctors, we are just learning from them, so we are not supposed to say that okay, should not take this, no. So
Hmm.
I would say that it's very important, because the high protein diet is important in the cases of PCOS or whatever kind of growths you're having. Protein is very must and important.
Absolutely.
How are you going to meet your protein needs if there is like if you are somebody who's eating non-vegetarian food, you should eat that. But there should be some difference in how you're cooking it. You know
Hmm.
it very well, right? Like it depends on how we cook.
Right. Like resort to like more ways of not including too much fat when you are like cooking the meat. So
Yes.
instead of frying, opt for grilling or something like that on those lines. Because I know that in a lot of parts of India, we steam the fish in banana leaf, which is a very good alternative, I think, than just
Yes.
frying or, like doing those things. So Thank you so much for bringing this to light, because I'm sure, like, just like me, people are confused if they are following like an Ayurvedic diet, they only have to eat plant-based foods and they cannot never like include animal-based foods. So thank you so much for mentioning
Yeah,
that. I
it's just because, like I said, because of the societal influences are there. Because like I said before, because India or the countries those who are having, and the thing is, the old practitioners, those who were from that particular societal cultures or from
Hmm.
particular communities, so they only promote what they eat. If
Hmm.
they are not eating non-vegetarian food, they will be like having a great aversion toward all this food. Now see, me being I'm a vegetarian,
Hmm.
but I believe that those who want to eat something, like if they're eating non-vegetarian food and if they are getting enough nutrients from it, go on with that. Just
Right.
change your cooking style, just change the way you cook it. That's
Right.
it.
I love this. This has been like such an eye-opening conversation in general, you know. Thank you so much like for sharing your wisdom with us today. It's been a pleasure, and I really hope that the listeners feel empowered to explore further from qualified professionals about Ayurveda for their PCOS journey.
Yes, because I have seen people who actually have issues when they want to choose Ayurvedic treatments, because they say that, oh, you guys will never let me eat anything, so I don't want to do it with Ayurveda. So this is how they say that. But I will say, see, you can do this. The only thing is, you cannot actually put someone on a very strict diet because it is not sustainable after a particular time. Or they may be good when you are treating them. If you are putting them very strictly, they will be good when you are treating them. But after your treatment, if they're out of it, they will start eating anything they want. If you're actually letting them crave for it more and more, they're going to do that for sure.
Right. If you tell them that they can never eat a particular thing, they will do it in secret and just never tell you that they've been eating it. So
I would like to add one more point if you
yeah,
have the
please.
time, because, like I said, which is baking, grilling, boiling, steaming, these are all like very good. Instead of frying, like,
Healthier
yes,
alternatives,
healthier
yes.
options they can do. And one more thing is there, because people are not promoting. It is said like Ayurveda never promote the intake of milk or something. It's not that like that, because that is there because many of people are lactose intolerant now. So I work with my company, and we are doing this epigenetic lifestyle modifications. So when we are seeing their epigenetic report, what I see is, every time majority of the patients who is there, or the clients who are there, having lactose intolerance.
Right, right.
Since they have lactose intolerance, they have to choose for something which is lactose free.
Sure.
This is also there. So actually, one thing which is important in Ayurveda they're mentioning, and which is like buttermilk. It's not
Hmm.
curd, it's not yogurt, it's buttermilk.
Right.
So buttermilk is very important. So I will say that if I'm not saying about buttermilk, maybe the old acharyas will be a bit upset, because which is very important.
No, I love that. And of course, like Indian buttermilk has been, shown to, act as a digestion aid, and it's filled with
Yes.
probiotics, which is very helpful for
Yes.
gut
You
bacteria.
said that word, probiotics, and
Yeah.
like, this is very important.
Yes. No, and again, like, thank you so much for all of this wonderful information that you have shared with us. And to all our listeners, we really hope that you found today's episode helpful and somewhat inspiring and educational. And just remember, like, balance is the key, you know. And
Exactly.
sometimes it takes more holistic approach to truly heal our bodies. So, thank you very much, Dr. Vishnupriya, for your time and sharing all of this wonderful knowledge with us today. And of course, we are going to like request all of our listeners to subscribe, rate, and review this podcast. And do check out Dr. Vishnupriya. And to all the women with PCOS who are interested in Ayurvedic treatment or alternative medicine, please get in touch with Dr. Vishnupriya.
Thank you so much,
Right.
Dr.
Thank you
Miteshri.
so much for today's time and
Yes,
safety.
that was really so nice talking to you about the something which I'm so interested to share about.
You're
So
very
this
much.
was like very insightful. Like this is actually the midnight in India, but still, what I feel like is this is like an early morning because I'm so fresh now. I'm
I
feeling
love
so
that.
fresh
I
now
love that
after talking to
energy.
you.
No, thank you so much. Again, like I know you've been awake just to get this recorded, so I'm so grateful for your time and for your
Actually,
energy.
I'm very grateful to you too, and all the entire team, those who are behind this, because this is a very innovative kind of thing that you're doing. Because it's very important to aware people. Awareness is the key. Awareness is there. Awareness should be there. So means it's a big round of applause to the whole team, and you're doing a great job, and which is like again giving me an opportunity to talk to a lot of people. I don't know who will be listening to this, but still, if I know them, if I don't know them, I'm wishing them all the very good and success in life, and to you too.
Thank you
And
so much.
yeah.
I appreciate it.